State Governor Gavin Newsom unveiled the state's endemic response plan, shifting away from mandates and lockdowns and now focusing on prevention and limiting outbreaks.
A political reporter, Morgan Rynor, joins us live from the state capitol with details on this new approach. Morgan?
The big difference is being prepared so that the state can act quickly if there is another surge. That means stockpiles of millions of tests, of masks, 1,000 ventilators, and even healthcare workers. But what's just as important as what's changing is what's staying the same. If we do enter into another surge, the state can continue implementing whatever mandates it sees fit.
It's called the off-ramp, on-ramp approach.
While we can't predict the future, we can better prepare for it.
What exactly does the on-ramp look like? If cases and hospitalizations go up, what happens?
If you started to see an outbreak here in and around the region, down the road, or here in Fontana, or down the road, Riverside, anywhere in the county, i.e. all of a sudden, now we've got a team of folks, epidemiologists, Office of Emergency Service, Department of Public Health, whole cross-section of folks in this new unit, and they move in real time.
His plan says for schools to prepare for vaccine requirements regardless and mask mandates when needed. Newsom's plan does not, however, have any metrics that would trigger the on-ramp approach. The plan is supposed to help Californians live with COVID, but part of the message today is not to get too comfortable.
There is no end date, that there is not a moment where we declare victory.
The state is committing resources to help with the on-ramp scenarios, stockpiles of tests and masks.
But also making sure that we are stocked and ready if we see a more virulent mutation of the virus in the future.
Now, in order for the governor to continue putting mandates or requirements in place, the state will need to remain under a state of emergency. But just today, the Senate set a date for the first time they're going to hold a hearing to debate the merits of a state of emergency. That's March 15th. And when a reporter asked Dr. Galley today about how that hearing or a decision on it could impact this new phase, he says he wasn't aware that the date was set.
Morgan, let me ask you about some of the fine print in all of this. It looks like the governor is trying to get COVID tests manufactured in the state of California. Is that correct?
Yeah, the state plans on putting out a request for ideas on a public-private partnership in order to make their own masks and tests, and that will reduce the cost of it, but also help us find them on shelves again.
Yeah, everyone hoping that we learn some lessons and are more prepared for anything like this that hits us again. Morgan Rynor reporting. Thanks, Morgan.